Thank you. Hello, everyone. Good afternoon and welcome to today's press conference. We are joined today by Lucy Whiteman, the Director of Public Health, Becky Bradshaw from the University of Northamptonshire, Jonathan Nunn, the leader of Northamptonshire Borough Council, Tom Beattie, the leader of Corby Borough Council, Simon Blatchley from Northamptonshire Police, Katie Brown, the Director of Adult Services for Northamptonshire County Council, Paul Andrews from the Education Department at NCC, and last but by no means least, Councillor Jason Smithers, Cabinet Member for Transport at NCC. So I'm going to, we'll follow the same format we do normally. We'll come to Lucy Whiteman for her update on the figures this week. Then we'll come to Councillor Tom Beattie for his view on the local situation. Then we'll go to Jonathan Nunn for his view on the local situation. And then we'll open up to the submitted questions. If everyone could put their hands up as normal, if they have a question subsequent to the ones that have been submitted, that would be great. Thank you very much, everyone. I will now come to Lucy Whiteman to present this week's figures. Thank you, Lucy.
Thanks, Councillor Morris, and good afternoon, everybody. Thanks for joining us again. Sadly, it's not as pretty a picture as it was last week. I'm sure certain people will have been expecting this, but basically our number of cases has doubled, or more than doubled actually, in the last week. We'll go through some of the reasons for that, but obviously Northamptonshire residents are therefore being asked to very strictly follow the national guidance and the local recommendations. We're seeing a significant level of community transmission, particularly within households. So again, we'll go through and reinforce some of the key messages around that. But it is a significant concern, and this is a county-wide position. This is not, limited to particular boroughs and districts. So if we go on to the second slide. So obviously there's been national guidance, and we've continued to encourage residents to work to that. As I said, there has been some level of non-compliance, and we're really just trying to implore people to recognise the increased threat locally and to very strictly adhere to that guidance. It is there for a reason. We obviously continue to reinforce where the new guidance is. We understand there's going to be further guidance being released on Monday, and we will of course update the links in our report accordingly. All of the current guidance again is available through the links in our report, and we are encouraging everybody to continue to engage with the test and trace process, which locally obviously we've got the resource to follow up, and it means that we're able to support people to identify themselves as a potential contact and reduce any potential onward transmission of the virus. I'm sure the media will be aware that there now is a financial support for certain eligible individuals if they are required to self-isolate, being a case or a contact. And again, we're providing links to the relevant district and borough websites to find out more and to be able to apply for that if people feel they are eligible. If we go on to the next web link, please. Thank you. So locally, obviously we've been asking for people to adhere to the national guidance, but we've also been recommended restrictions around multi-team sporting events, because we know that young people and obviously their younger parents are at particular risk at the moment, and we're seeing the biggest increase in cases still in our younger population. So we thank people for continuing to adhere to those local recommendations, but we're also adding a recommendation and a request for spectators to be kept to a minimum, or if at all possible for them not to be allowed into sporting events. We are still seeing a significant increase, as I said, in the age group most likely to attend such events, and it is a real concern. We are also sadly having to make a recommendation again that health and care providers review whether they should be allowing visitors. Obviously, we were really pleased to be able to lift that recommendation last week because we were in a better position. Sadly, Northamptonshire has followed that national trend with a significant spike in local cases, and therefore our recommendation would therefore be that it's limited again, other than to extenuating circumstances such as support at end of life. Again, we continue to reinforce the request that people adhere to guidelines around events, celebrations and social gatherings. Obviously, we do recognise that people continue to want to celebrate certain events, but to do so sensibly. Just because you can do certain things at the moment doesn't mean that you should. And I think that steep and significant rise in cases is a real demonstration of where people need to be applying common sense and being as sensible as possible with those larger gatherings and any intervention or position where they may be in contact with other people, to be taking precautions such as wearing face coverings, meeting outdoors if wherever possible. And we continue to work with recruitment agencies to try and keep worker double sort of placements to a minimum to reduce the impact and limit the risk of infection in more than one location. So if we move on. Again, these are the messages that we've been asking now people to obviously adhere to locally. The 2 metre rule is one that we've stuck to for all the right reasons, and I think we must reinforce with this unusual and significant spike in our cases. We're obviously imploring people to follow the rule of 6, but even then to go further. And as I said, just because you can doesn't mean you should. So really consider whether even meeting with 5 other individuals is sensible under the circumstances. And if indeed you must meet, then to try and obviously encourage people to do that outdoors. I do recognise the change in weather is certainly not encouraging people to do so, but it really does limit the risk, both to yourself and to others. If you again, are in a support bubble or in a household, obviously to limit use of and sharing of utensils, particularly outside your household and bubble. If you are meeting and social distancing is not possible, to always use a face covering, even in areas where it isn't a requirement, it is a sensible step. Again, avoid using public transport or car sharing, but again, if you have to do so, wearing a face covering, and that is covering your nose and mouth fully, both whilst you're waiting for the public transport, during the journey, and until you are back out into an open space. Again, reinforcing hand washing frequently and thoroughly, and again, the national guidance around working from home, if you are at all able to do so, again, would be one of the things that we are recommending locally to reduce the onward transmission of the virus. So if we move on. People are familiar with this slide. It provides the public with links around guidance again, but also links to getting a test and also to the contact tracing information and case information. So if we move on. Wanted to get into the case numbers so people will see what I mean by a significant and rapid spike in cases. We've gone from 163 cases to 417 in the space of 1 week. Now, we do recognise that the Public Health England IT issue with the upload of data files potentially causing some cases not to be allocated to certainly the test and trace system, but it also having a potential impact on the allocation of cases to the appropriate local authority. We are assured that that is not an issue here, that although the cases may not have been allocated to the exact correct date of the test, these are still real cases in Northamptonshire in the last week. So again, I implore people to recognise the severity and the significance of the change of position in the last week, and obviously to adhere therefore to not just the national recommendations, but the local recommendations, and to consider, just because they can do something, whether they really should be doing it. So if we move on. Again, you can see, as I've talked about, it is our younger age group that is still being most affected by this. So this is the last 28 days by gender and by age band. You can see that the age distribution is actually more equal than it has been previously, both females and males. But again, you can also see that increase in age 50 to 59-year-olds. Now, again, this is likely to be to that household transmission. So, you know, younger people aged between 10 and 29 still living at home and potentially infecting older adults, be them their parents, their carers, or potentially people that they work with. So again, we're reinforcing what it means to self-isolate. If you are indeed a case, not only should you be staying within your home, but you should be trying to stay within a room in your home. Limiting contact with your family members. We're seeing a significant number of household clusters where you've got 2, 3 or 4 cases within one residential address. Now, it's highly likely only one case got infected in the first instance and that the transmission has then happened within that household. Yes, it may well have been happening before. Obviously, the first positive case came back or was notified through a test process. But indeed, we still feel there's an opportunity, if people understand they should be isolating within a room within a household, limiting contact with their family members, you know, if possible, utilising a bathroom after or a kitchen after other people, taking extra cleaning precautions just with a simple bleach-based solution. And as I said, cleaning things like their towels and using it separately, using a dishwasher to try and clean dishes, or as, you know, cleaning them in as high a temperature as possible. All of these things limit the risk of onward transmission. So if we move on. Very stark picture. As I said, this has affected the whole of Northamptonshire. Every single borough and district has seen an increase in cases. You can see that most starkly, obviously, in Northampton and East Northamptonshire, an area that hasn't really featured much in our reports, but has been significantly impacted by the spike recently. Can we move on? Again, if we do our comparative rates, you can see how that's now affected our race. East Northamptonshire going up to 55.4 cases per 100,000 as a rolling 7-day average. So although still similar to our county rate and lower than the England rate, I don't want people to take solace in that. That is not where we want to be. This is a significant change and a real warning sign locally. In other areas in the country where they've seen increases like this in their boroughs and districts, 3-4 weeks later, they've seen increases in hospitalisations and deaths. This is not the trajectory that we want people in Northamptonshire to be on. If we move on. Again, you can see that stark national rise, but you can also see with that yellow line and also with Wellingborough, the grey line, a recent increase, and as I said, in East Northamptonshire, a stark increase in case numbers. We have to get on top of this, otherwise we will end up seeing ourselves in a position as those boroughs and districts are struggling with up north. We move on. Education status is a more positive picture. I know we've got Becky from the university who will be speaking a little more later, and we've obviously got Paul on the line as well, but you can see here at the moment it is a positive picture. We recognise that the general increase in cases is likely to translate through into these figures at some point, but we have a small number of outbreaks in our county at the moment associated with schools, and thankfully a small number of cases associated with each of those outbreaks. And again, you can see a small number of cases at the university. A very positive picture. 93% of pupils attending school at the moment, which compared to this point last year is only 1% lower. And my understanding is from Paul that is still increasing. So very, very positive. But obviously we do recognise that this continues to be, you know, these continue to be settings of high risk, and we continue to support the university and the schools and the schools themselves to obviously make sure that they're creating as safe an environment as possible. But with that increase in community cases, you know, we want to make sure that our pupils still attend school as much as possible. It's really important for their long-term potential and benefit. We move on. So no surprise here. Obviously, it is still our more deprived, our more highly densely populated areas that are affected. The anomaly, as I'm sure you will see, is that East Northamptonshire is starting to feature more so on this map. Again, it bucks the trend. It's a more rural area. And therefore, obviously, we're working with the local authority, the environmental health officers, etc., and local businesses to understand what the driving factor of that is. We do recognise there are a significant number of students that usually reside in East Northamptonshire but are at universities elsewhere, may have had their case, their case allocated to East Northamptonshire despite the fact they don't currently reside here, but it is still not enough cases to explain the sudden increase in that area. So just, you know, to recognise there are still some data challenges around where the case is allocated, particularly to university students, but that doesn't explain our position. So if we look at the next slide, that provides us with a rate, and that's why, obviously, because it's a rate, the position changes slightly. Northampton, Kettering and Corby still feature very heavily on this, and therefore obviously continue to again be part of the focus of our efforts. We are also targeting, obviously, as we continue to, our communications and our engagement around our geographies and around our specific age groups that are most affected. So if we move down now to the slide with the outbreak summary on it, please, Alicia. So at the moment, we've got 21 active outbreaks, as people can see, a total of 85 cases associated with those. You will see again that they're distributed across the different geographies in our boroughs and districts. There's no one area that is significantly higher than others. Northampton again, and Kettering being more densely populated, having more care homes, etc. You know, again, it's a relative number of outbreaks. Clusters are small. Obviously, you can see the schools featuring there. And again, we continue to be able to report exposures at the moment, but we do recognise that limitations in PHE mean that will start to be less of a feature in our future reports. As I said before, they continue to monitor exposures, and we are able to access data so that if we see a number of cases that report having attended somewhere, we're able to track back to see if they all had a linked exposure. So to provide reassurance, we still will have access to that data, but it just won't be reported in the same way potentially going forwards. So from a messaging perspective, obviously, if we can move forward with messages, we're continuing to work on a series of programs, both visual, very visually led posters, GIFs, and other things. We're making sure that we're utilising social media channels so that we're reaching out to the population that's most at risk at the moment, again, our younger population. But obviously we're doing whatever we can to make sure that we understand what drives the behaviours across our different age groups and utilise different channels to work with them respectively. We have now completed a survey with young people, and we'll be using those insights to help again shape some of our communications messages going forwards. The next slide. People are aware of the work that we're doing. They're aware of the fact that obviously we continue to work with media, and again, thank you for supporting some of the messaging locally. We continue to work with schools and all of our high-risk settings, particularly our workplaces, to make sure that they get the support that they need. And one of the things that we're obviously featuring more on locally is any increased activity in the NHS, our services. Sorry, Rachel, could just possibly mute.
Yes, sorry, somebody's just joined the conversation. Could you mute?
Thank you.
Carry on, Lucy.
We are very conscious of the fact, as I said, that we've seen an increase in NHS service pressure in other areas of the country where they've seen community cases increase, and therefore we're monitoring that not only just overall but also specifically for over 65, because as we know they are the most vulnerable. And again, we'll continue to update partners on that at this weekly press conference.
Thank you very much, Lucy. A very detailed breakdown as always. I'm going to come now to Councillor Tom Beattie, the leader of Corby Borough Council. Hello, Tom.
Yeah, hi, Ian. Thank you. I would just say that I need to leave the press conference at 3:30, so I disappear. You'll understand why I have to be somewhere else. You know, we've been saying the same things, I think, myself and Councillor Nunn from Northampton about, you know, the need really to adhere to the advice and guidance that we've been giving out consistently, and been pleased to see that has made some impact in recent weeks. But I think none of us, are probably surprised to hear what Lucy has just said pretty starkly about the rises. We've watched what's been going on nationally on the news in the north of England, new regulations being imposed in Scotland. Northamptonshire is not immune, clearly, and Corby, despite the fact that our figures aren't quite as high as some others, that's no cause for joy here. It's still the best of what is quite a bad bunch of figures, and I think we need to emphasise that you know, this. If anyone thought this had gone away, quite clearly, this week's presentation from Lucy has very firmly killed the idea that we can all relax. I would just like to reinforce the messages that we've been giving regularly about not being complacent, following the guidance. I know that the increased regulations, the increased sort of restrictions on everyday life is annoying. People want to enjoy their life. They want to enjoy their friends and families. and we don't want to be killjoys, but we must emphasize the importance of following the guidelines, the national guidelines and the local guidelines that we've been issued over and above the national guidelines, so that we don't get ourselves into the sort of situation that we're seeing in places like Greater Manchester, other parts of the north of England, as I've said, Scotland, and also it appears in Northern Ireland also. So it's just to make that point, and I think the media have a key role here in getting the message across. I know there's always a line between raising alarm amongst the public and trying to get the message right. We have to, without panicking people, we have to reinforce the point that we need to do what we have been doing and continue to do that. And if we can get that message across and get on top of this thing, then that's something all of us have to do. We all have responsibilities, not just to ourselves, we have responsibilities to others. I would urge people, for instance, who haven't yet done it, to download the NHS app. I did it. It's very easily done. It's quickly done. And to do all of and follow all of the advice which is currently being given. I think Lucy's presentation has, I think, shown the importance of that. I think it's a stark reminder, if we needed it, that rather than this thing being in retreat, that we're going through another spike, and that is worrying. And I just think we need really to pull together as communities and as individuals within communities and support each other and make sure we don't do anything which puts ourselves and other people at risk. And I think, Ian, that's as much as I want to say at the moment. Thank you.
Thank you, Tom. And I think we'd all agree with you on that. And it feels a bit to me like we're not there yet, a tipping point in the country from which it could be a disastrous point if we reach that. I think there's still a chance to escape that tipping point, but without everyone's hard efforts, I'm not sure that we can. But I mean, that's just my view on it. Can I bring in Jonathan Nunn, the leader of the Borough Council, to discuss what he feels is the current position? Thank you, Jonathan.
Yeah, thank you, Ian. Good afternoon, everybody. And first of all, obviously agree with everything that Tom has said, really. What a shocking headline. Cases have doubled within the past week. That is absolutely serious, isn't it? That tells us how serious this is. I mean, this virus is transmitted between and amongst people. You mix more people together, you spread more virus, is ultimately it. And we've seen some changes in guidance, which has allowed more of that to happen, and people return to some of those activities more and more that we might have taken for granted pre-lockdown. There's a number of messages in here. There's small comfort in the fact that we are significantly lower on that one page than the national average. That there's no comfort for us to take, as Tom says, but it tells us one important thing, because not long ago Northampton and Northamptonshire was right at the top of all those leagues. So the one important thing that tells us is that you can change this, and the people of Northampton and Northamptonshire have changed that. So if we take one message from it, what we have proved to the world is behaviour will change this, because we were right in the wrong place, and now whilst we're still in a bad place, we are in a below average place, if you like. So that's what we have to take from that, and that tells us that actually that mixing that I was talking about, it can be done safely. You can come into town, you can get on a bus or whatever, but you've got to follow those precautions. And despite alterations in guidance, really what it is, you've got to stop that virus getting from the other person to you, or from you to the other person. That's simple. The guidance says wash your hands, the guidance says wear your mask. That's obvious, but we know how viruses transmit. We know if we're going to be closer to someone, it's going to transmit. So whatever you might say about guidance changing, actually the key things are consistent about washing your hands, wear a mask, keep distance from people, not sharing objects. All that stuff, is the same stuff week after week after week. What is a challenge is some aspects of daily life, and amongst the many things that this virus has stolen from us in being able to get about and live our daily lives is the way in which we travel, the carefree way in which we might be able to travel, jump in a car with somebody else, which we're still advocating is not a good idea if you can possibly avoid it. Even jumping on a bus is not a good idea. And I know this is of increasing concern. In fact, I think Alistair and Carly at the Chronicle and Echo have both raised this, particularly perhaps in questions, and I think we've had some photos from Carly, and they show a number of things. One, they do show, okay, here's the good news, and this evidence is the change in behaviours, because they show a bus queue of people all wearing masks. That's great. And that shows that people will change their behaviours. What it does show, though, is people very, very closely together, as much a scrum to get on the bus as it is actually, I would say, in that photo, a queue. And that's something we've really got to change. But you know, how do we do that? There are hundreds of bus stops all over. There are more buses being laid on, I understand, to make that easier. But it's all about that behaviour. And what we've asked the people in Northampton to do before, and they've responded to so positively, is to change behaviours. And we can evidence that through the infection rates. Now we've got to really push them again and say it's time for another kick into this, really knuckle down and stick to it. And one of those key areas has got to be buses. And the only way we can do that is a change of behaviour. It's not just through those people on the screen, although all of us on the screen, if we jump on a bus, we have to follow it. Actually, it's the 225,000 people, in my case, in Northampton. Every time we jump on a bus, we've got to queue safely. Thank you for starting to wear masks in the way that you have. That really is valuable, and we can guarantee that has saved a lot of people getting this horrible, horrible virus and then spreading it to the people that they love. But you've got to queue safely, and the only way we can do that, our only weapon in that, is encouraging and urging and cajoling as best we can people to make sure they do that. Thank you, Ian. I think that's my view of things as they are at the moment. Thanks.
Very much, Jonathan. Very succinct as always. Can I open up to the questions now that the written questions that we had? So the first one is from Phoebe Radford from Northants Telegraph. I'm just looking to see if you're on the call. Hi.
Hi.
Hi, you are there. Hello. Hi, good afternoon. Some of your questions may already have been answered. I don't know, but I'll leave it with you to put your questions forward, Phoebe.
Thank you. So first was wondering whether, like, where you think the biggest risks are now coming from with the rise in cases. Where are people catching this? And, you know, what would you advise is the safest thing for them to do, and what should they be avoiding? Because this seems like quite a sudden spike. So are they coming in workplaces or in schools or from visiting hospitality venues? Like, where has this surge come from? And now Northampton and Kettering and others have been taken off the area of concern list. Have we lost that additional testing capacity that we had from being on that list? And is that hampering the response of monitoring and responding to the COVID crisis? And with this surge in East Northamptonshire, I saw on the slides that there is one current outbreak in a workplace in East Northamptonshire. Is that a significant outbreak?
Thank you very much, Phoebe. Some very good questions in there. I'll pass it over to Lucy Whiteman to answer as many of those as she can. Lucy.
Thank you for your questions. So the surge is community-based. You will see that actually, from a point of view of our outbreaks, we don't have a significant number of outbreaks, and at the moment you can see from the case numbers, particularly now that Green Corps has kind of worked through that process, that actually these are not significant outbreaks in and of themselves. You asked about the outbreaks in East Northants, and at the moment of the 6 workplace outbreaks across the whole county, there's only 24 cases associated with them. So these are, at this point in time, not significant outbreaks, but obviously we continue to monitor that, because we know from Green Corps they can obviously increase in numbers quite quickly. So we work with PHE and our environmental health officers, health and safety executive and others to make sure that we obviously monitor those. We have outbreak control meetings very early in the process of notification. We undertake site visits, we review risk assessments, and then we take appropriate action. So that's not the driving factor in East Northants, and to be honest, outbreaks themselves are not the driving factor across the county, it would appear. Again, we would also release those figures around case numbers in schools and universities. This does seem to be being broadly driven by community transmission, And the data that we're receiving is suggesting again that those, as I said, household cluster numbers are increasing. So rather than seeing one case or two cases in households, we're now seeing 3 or 4 cases in single households. So as I said, that demonstrates the fact that people, if they are symptomatic or indeed if they've had a positive test, are not isolating within the household itself. So you will see more communications messages coming out from us that actually specifically detail some of the actions you can take within your household to limit the risk of onward transmission. But it also reflects the nature of COVID. It is a silent killer. It unfortunately has a very high incidence rate where you have people who are asymptomatic. They don't have a cough, they don't lose their sense of smell, they don't have a temperature. So not every positive case will be identified, and therefore onward transmission unfortunately is challenging. As you know, Jonathan's already pointed out, if you're not in close proximity with others, you reduce the likelihood of you getting it, because not everyone will know when they do have it. So that's part of the battle. We recognise that's more challenging within a household, but we are seeing that transmission at the moment driven primarily by household clusters. Testing is not an issue for us locally. The capacity at the moment nationally is that the lab is able to process 90% of the slots that are available through the national testing services. So that's the home testing kits, the local testing centres and the regional testing centres. At the moment, we have capacity locally, both from a laboratory perspective, but also from an actual swabbing perspective in all of those local facilities. So again, we remind people that if they have even the slightest symptoms, that they should be seeking testing early, and they should be isolating within their household, away from their other family members. The rest of their household should then be isolating as well until those test results come back. If they're negative, everybody's free to continue with life as whatever normal is now. If they are positive, the case must isolate again away from the rest of their family members for 10 days. Even if the rest of the family members get negative tests, they still have to isolate for 14 days because they could be incubating the virus. And some of those messages I think have got lost over time. We'll be reinforcing them over the next coming week.
Thank you very much, Lucy, for that answer. Phoebe, thank you for your question. I'm going to move on now to Alistair Oak, also from the Chronicle and Echo. Alistair, are you there? Hi, Alistair.
Can you hear me, sorry?
Yes, can hear you. Welcome. Good afternoon.
Good afternoon. Good to speak to you. All right there. Sorry, just to trip over some of the figures we've heard today. We said this is the biggest spike since the Green Corps incident, of course. Does that make this the biggest spike we've reported so far?
Thank you for that. Lucy?
From the point at which this report's been available, yes, absolutely. Obviously, we had significant peak in the earlier part of the year. So case numbers are not as high at that as they were at that point, but certainly since the report has been available, it is the highest spike. Obviously the challenge at the beginning, just reflecting back on comparing 2 different time periods, people were only being swabbed if they were hospitalised at the beginning of the pandemic. So those were cases who were severely unwell. This is about community issues and community transmission. The risk here is that it translates into a position that we saw earlier in the year.
Thank you. Alistair, did you have any other questions while you're there? No? Okay. Sorry, Alistair. Are you there?
Sorry, I was talking to myself. I was on mute.
No, that's very dangerous talking to yourself, Alistair. It's, you know, you don't want to get yourself into trouble. Right, Alistair, carry on.
Yes, thank you. Sorry, Lucy, just to carry on. To repeat what we said earlier, you wanted to be sure that to let people know that this isn't because of the IT glitch report by Public Health England. I remember Northamptonshire, we had a share of about 70 of those cases. Was it that those cases, those 70 cases, or even any of these cases, aren't baked into what's been reported today? This is fresh cases not related to the IT glitch. Is that what we're saying?
No, so those 70 cases are baked into this number.
Okay.
You know, these are still very recent cases. The reporting period may extend slightly over a week, which is obviously what we usually try to stick to, the week's cases. Some of them may be actually a hang up from the previous week because they weren't reported in time. But it's still, as I said, no matter how you cut this and no matter how much deep dive we've done into the data, we are not finding that explains the rapid increase. And the risk here is that up to 70 of those, as I said, were not then reported to the contact tracing system, and therefore onward transmission, the risk of onward transmission with those cases is much higher than it would have been had that PHE test and trace process worked. So we are quite likely to see an increase even on this position next week.
Okay. Thank you very much. If I was going to pivot to what Jonathan Nunn was talking about to do with transport, I don't know if you've been able to see 2 pictures that we were sent this week that we forwarded on when we sent our questions in. They were just of a very large queue on the Drapery in Northampton Town Centre. We are being sent these pictures of large groups congregating at bus stops like on the Drapery. It seems particularly busy for routes going to, say, Grange Park, Brackmills. And we're trying to gauge in what situations how much of it's masked and stuff. Public transport in Northampton and Northamptonshire, how much of a concern is this for you? And so we can ask more questions. Whose responsibility is it to monitor that and take appropriate enforcement action? Because we don't know. We see these images, we don't know who to ask, basically.
Thank you very much, Alistair. I'm going to bring in a couple of people, if I may. Councillor Jason Smithers, are you there, Jason?
Here, and yes, hi.
Hi.
Yeah, so I mean, we really need to take on board Lucy Whiteman, Director of Public Health, stark warning that she's just given us about the rising figures, and of course it's really concerning when we see pictures like that. But it's really refreshing to see, though, with those pictures there were quite a few mask wearers there, so we're entirely grateful for that, and we continue to monitor this on the Drapery. And other key bus stops with Northampton Borough Council and the police as well. So what we do want to sort of get out there is the responsibility of those individuals using the service to follow the guidance, which we've all heard, about masks, washing hands, that, keeping a good distance. And that it does include wearing a mask whilst on board and to socially distance while waiting for the bus. And again, I'm grateful for the many that actually do this, regularly on a daily basis. So we have put up additional signage on the streets and pavements and around the bus areas of Northampton to remind people that they need to wear that mask and socially distance. And we continue to refresh that signage as well. So the police have also undertaken some education directly in the area as well. And we're entirely grateful to their support on this because it's a difficult situation. We have weekly meetings with our transport providers, and we monitor issues on the network and report monitoring loadings and key journey routes and so on. So this enables operators to provide us, where possible, additional buses on key popular routes to enable the social distancing. So following an increase in usage from the Grange Court, our operator there, Stagecoach, introduced additional buses from Grange Park with effect this week. So this will be early in the morning. 7 buses will be running instead of 4. So there is a commitment there to try and ease this congestion. So, at 6:10 in the morning to 6:30 time band, there's going to be more buses running, which will hopefully help with, getting people on and off the buses quickly. So we're also using our electronic signage as well to ensure passengers are being warned about socially distancing and use all available buses and not trying to cram onto one. So it seems Brackmills is also experiencing similar trends. So we'll be discussing that again with our transport operators this week to try and understand what we can do to assist in that. So we're also, and I mean, Christmas is just around the corner, so we're also keen to engage with employers locally as well to understand their intentions about increasing staff on the run up to Christmas, with temporary staff, so we can look to plan for that as we move forward and look at how we can resource extra services across the bus route. So, in a nutshell, we're trying to do what we can there, but we just need everybody to play their part and to remember the key advice, which is wash hands, cover the face, and ultimately make space between each other. Thank you.
Thank you very much. Alistair.
Yes, if I might answer a follow-up question then, also for Councillor Smithers and maybe for Simon Blatchley, if he's on the call. A follow-up to that, would you believe there needs to be more enforcement action, possibly? I ran a story this week after I asked the Northamptonshire Police if they'd handed out any fines at all for failure to wear a mask since the outbreak began, and the answer is no. It's in line with the rest of the country. 33 other forces in the England anyway have also not handed out a fine for mask wearing yet. But question to Councillor Smithers and to Simon Blatchley: is this an area that now needs to be stepped up to maybe enforce this mask wearing? People have had enough time to know what the rules are.
So, Ian, if I may, I think when it comes to this type of subject, I think, Alistair, it's best to try and educate the individuals to understand the risk that they're posing to themselves, their loved ones and families and so on. So, I think we're going in with a task of trying to educate them by signage, by multimedia messages and, social media messages and all of that. But regards the sort of side with the police, obviously, I can't answer for that, but I'm sure our police representation could.
Thank you, Jason. That was a very, very good answer. Simon, do you wish to comment on that? Hi,
Yes.
Simon. Welcome.
Hi. Just support comments that have already made by the councillors, really. We're not going to enforce our way out of this pandemic. It is about individuals taking personal responsibility. Bus queues is one item. Yes, we work with our partners and identify where we need to increase our patrols. Drapery has been mentioned, so there will be some more high-profile patrols in that area. We do still try and engage, explain, encourage before we do enforce. No, we have not issued any more tickets since the last press conference that we held. Yes, we've made it clear to officers, because any enforcement of a ticket is of course up to individual officers' discretion to engage with the public and issue a ticket if absolutely necessary. But we can encourage and explain, that is what we will be trying to do. But it is a joint responsibility with partners. But I have to say, it is about the same messaging that Lucy's mentioned and the councillors from across the county about people taking personal responsibility for their own health and safety and those of the rest of the community. Thank you.
Thank you very much, Simon. Alistair, I'm conscious of time, so I'm going to move on to Kevin Nichols. Kevin, are you there, Kevin?
Yeah, hi Ian, I'm here.
Hi, Kevin.
Thank you very much. Yeah, I'd just like to ask Lucy, and she mentioned, I think briefly, that there's some new guidance from the government coming in on on Monday. I just wonder if you think that's going to be enough, or if there's likely to be some more, or is there anything you'd like to see further done?
Lucy.
Kevin, it's a very insightful question, and it's one that is quite challenging for me to answer in probably as politically correct way as I should. Do I think enough is being done? No. Do I worry that the new legislation or rules being brought in on Monday will be enough for areas that are at threat of significant increases in cases? My concern is not. I obviously am awaiting that guidance. If I wasn't waiting for the guidance, I actually would have gone harder with messaging today, but I don't want to put local restrictions in that I then have to backpedal on next week if they're not aligned with the national guidance. So I await with bated breath to see where Northamptonshire would be placed on different levels of intervention. As I'm sure people are aware, that's the likely publication that's going to be coming out, and what restrictions would be therefore applied to each area. If I and my partners do not believe that they are enough to stop or stem the flow of cases locally, then we will be taking more local action, be those recommendations or indeed legislative action. We need to make sure that we do not escalate in the same way as we've seen elsewhere, because we know where that heads, and that is a lockdown that is not good for people's mental health, for the economy, for a number of reasons. But we recognise if we don't get on top of this soon, that's exactly where we could be. So we will take steps if we do not believe that the local lockdown levels that are being worked on at the moment provide Northamptonshire with the opportunity to reduce the case increase.
Thank you, Lucy. Again, a start.
Thank you for that, Lucy. That's excellent. Can I just one follow up, Ian, if I may, just very quickly, because the what's being announced on Monday seems to have been coming for quite a while now. I just wondered if you think the government could have acted a little bit quicker in this instance, bearing in mind that they stepped in very quickly over Green Cora last month.
Again, I tread carefully. Would I like to have seen them bring measures in more rapidly, that provided clarity not just for the public but for also, you know, the public health teams, the police, etc., who have to enforce the different guidance and the ever-changing guidance. Yes, absolutely. But do I recognise the challenge in being able to balance the economic and the health argument? Yes, I absolutely do. And they themselves, you know, health and wealth are very closely linked. And, you know, we only need to look at Greencore, where we've seen some of our most deprived residents end up out of work for periods of time, and had Greencore not stepped up in the way that they did as a very responsible and considerate employer to support their employees, that would have had significant impact in the very long term for those employees themselves. So I recognise the challenge. You know, we've lived it locally between the economy and health. But do I think that there are steps in between that could be taken and potentially should have been taken before now? Yes. And as I said, that's why I await the guidance, and we will reflect locally, both through the Local Oversight and Engagement Board and through the Strategic Coordinating Group, to reflect on whether we think it's enough. And if it's not, and we think that there is still an opportunity to, as I said, stem the flow of cases locally, then we will take those steps, because we do not want to end up in a full lockdown. That's not good for anybody.
Thank you very much, Lucy. Thank you, Kevin. I am going to move on now to Jack Duggan. Hi, Jack. Are you there?
Hi.
Hi, Jack. Good afternoon.
Hi, thank you. Glad you can hear me. My question, just mentioned mental health earlier, Lucy, and just a question to her and anyone else, just about maybe the potential impacts on people's mental health of this whole situation, as well as, you know, potential lockdowns, and just wondered how concerned you are about the impact of the pandemic on people's mental health. Has there been any increase in referrals to mental health services, and what measures have been taken to help people if there is an increase in demand?
Thank you for the question, Jack. Lucy, over to you. It's something that we're all very aware of, the mental health of everyone in Northamptonshire as well as in the country. It is going to be a massive issue. Lucy, over to you.
So I know your sort of pre-submitted questions asked quite specifically about our case numbers in hospital as well. So there are currently 15 cases being treated in our acute hospitals for COVID-19. That's about 1.3% of our bed base. That's enough. That's where I want it to stay. And that, you know, that is the real concern, is that, you know, where we've seen case numbers, as I said, increase in the community, we've seen that then sadly infect people who are more vulnerable, who are older, who are multimorbid, who have a lot of long-term conditions, and therefore are much more likely to have a negative outcome in relation to COVID in the north. We don't want more beds occupied by COVID positive patients. And, you know, playing back to what everybody's been saying, this is about us taking responsibility, not just protect ourselves, particularly young people who feel that it may not impact them significantly, even if they do become positive. It's about the risk that they pose to other people, and we have to take responsibility for that. From a point of view of mental health, yes, there is a tsunami, I think, of mental health issues coming. I know from personal experience, obviously this impacts on you. It's been a really difficult time. It's anxiety inducing, you know, it is isolating, and that is translating into more referrals for support with low-level mental well-being challenges, both to our charitable organisations locally and also our formal care providers. It is a concern and has been discussed at our Adult Safeguarding Board, for example. So this is something that all agencies are concerned about and engaged in. It's something that we obviously will be looking at from a commissioning perspective, both in public health, but also across in our NHS organisations, to make sure that we are providing services in an appropriate way as well, because that's the challenge, is providing them in a COVID safe way when people need them. So it is being looked at. It is a recognised challenge. Yes, referrals are increasing, and we are doing our very best to meet that need.
Thank you very much, Lucy, and thank you for your question. Jack, I'm going to move on, because you can always come back in a bit later if we have a chance. Because
that's fine. That's everything I want to ask. That's great. Thank you.
Jack, because we've got a number of other people that want to ask questions, and a few hands are up already for subsequent questions. So I wanted to go to Ben Waldron from Northants Live. Ben, hi.
Hello.
Hi.
Hi. Yes, I've just got a couple of questions just on the curfew that's in place at the minute. First to the police, if possible, just whether you've been called out to any pubs or restaurants kind of after the 10 p.m. curfew due to customers breaking the rules and whether they're refusing to go home, etc. Then to Councillor Nunn, I know last week you spoke a bit about the kind of devastating impact the curfew is having on some hospitality venues in Northampton, and I was just wondering what you think could be done to help those that are struggling. And just quickly, finally, from the university point of view, I know we've seen in the report there's been 10 cases confirmed at the university. Just how many of these, how many students are self-isolating because of these, and are all of these in the halls of the university?
Thank you, Ben. I'll do them in the order you asked them. So I'll come to Simon Blatchley first from the police, then Jonathan, and then the university. So I'll start with Simon. Thank you.
Yeah, thank you. We haven't had any particular calls, any particular residents, but what we have maintained is our nighttime economy staffing. So at 10 o'clock, we do have visible officers out in all of the main town centres across the county. What we have seen an increase in is the number of calls from the public about breaches in people's personal homes. So where the rule of 6 is being breached, and parties are occurring, that's the bulk of the calls that we get, particularly at the weekends, rather than the pubs or clubs. Issues that we've had, as you say, pubs and restaurants, is the number of people, and it is generally the younger demographic out on the street, where we're then giving appropriate advice as we move on. But I can't give you a specific example of one, and we'll be out again this weekend on patrol as well, to be ready for that 10 o'clock to try and again engage and explain as far as we can and try and some prevention work. Thank you.
Thank you, Simon. I'll get everyone to answer first, Ben, just in case you want to follow up. So Jonathan, I wanted to come to you next about the local economy, which is so vital to our town and indeed the country. Thank you, Jonathan.
Thank you, Ian. And as was mentioned, we discussed this quite a bit previously, but nevertheless, we've seen more time now since we last discussed it. And there's little doubt it is having a very significant impact financially on those businesses that had really struggled and had been closed for so long, had the benefit, many of the hospitality businesses of the Eat Out to Help Out scheme, which seemed to work well for them. And I think also, of course, what that was leaning to was more the sort of pre-planned and booked, perhaps family dining type experience, and which I think is a better environment in which to control virus spread. You're sitting at a table throughout. There's less sort of mixing, socialising going on. I think one of the dangers also, a number of dangers also, is of course the risk that with places closing at 10 p.m. that people then take their socialising home. You know, it's still early, all come back to my house sort of thing, which may or may not be consistent with the advice at the time, and also at a time when people's inhibitions and their vigilance are down, which in itself is not necessarily a good thing. We've also seen, most particularly from other parts of the country, I'm glad to say, street scenes of people who have left pubs at 10 o'clock, but they're still drinking it and they're stood very, very closely. So there are spin-off dangers from the health perspective. I'm closely in touch with the businesses, meeting them soon along with our MPs to consider where we go next. And we have a role to stand alongside them. However, I have to say that the public health considerations are the primary considerations. And there is little doubt, as I said earlier, that if we do mix more, particularly when we throw in alcohol and allow our inhibitions to go down and our vigilance, there is inevitably a greater danger of spread. So my view is at the moment remains that it is safe to come in, for example, Northampton town, but wear your mask, wash your hands, and do everything you should. Use the NHS app. What support could be required for them? I'm uncomfortable that the answer is to campaign against the curfew, because I'm not certain that is the right idea for all those spin-off concerns and so on. There are still a small number of financial benefits that I think are offered to people within within the hospitality trade. I think they're getting a benefit at the moment on their VAT rates and so on. So as yet, I'm not entirely sure. I think we're going to see, because of the big spike that's happening now, we're going to see dramatic changes. I do fear that regulations around hospitality may be one of those areas that change, and I think at that point we'll have a clear view of exactly what we've got to ask the government to do. But I have pledged to businesses that on the basis of a sensible discussion and a reasonable rationale, I'll stand alongside them to urge the government to give them the support that they need. As yet, that precise support is not clear, I don't think. Thank you, Ian.
Thank you, Jonathan. And it's that constant balancing act between getting the numbers down and keeping the economy going. The worst possible scenario would be closing all our nighttime economy and everything like that. And that is something we must, rail against as much as we can. But the 10 p.m. is there for a reason, and we have to adhere to that. And I think that's a sensible thing. Becky, there was a question to you as well. Hi, Becky.
Hello, Ben. Thank you for the question. Obviously, our numbers were in this week's report. As you can see, we have had 10 cases in this period. But that is a mix, actually, of not just students. We've got a couple of staff cases in those numbers. And the vast majority of the student cases that we've got are not actually in halls of residence, so not in student accommodation. And some of them actually hadn't been into the campus or into the university in the days preceding their positive result or their symptoms developing anyway. They're simply linked to us because they are an enrolled student or a member of staff. I'm afraid I don't have the numbers to hand in terms of the number of students that we've got currently isolating in halls of residence, but what I can say is that they are being well looked after. So the moment we get a report in of a student that is isolating either because they're symptomatic or they've been contacted by test and trace or they're positive, they get some immediate information from us in terms of how they can get shopping deliveries. Our staff are then taking those deliveries with takeaways and other things to their accommodation. They've got the access of our counselling and mental health teams at their fingertips, and our residential life support team then have a regular check-in on them kind of every couple of days just to make sure that they're doing okay, and have extended their social program so that some of that can be offered virtually. And I think the other point to note there is that information also includes measures that they can take to try and prevent the onward transmission to others in that household. So again, taking that point on that was mentioned earlier, I think that's really important to note that we are trying to make sure that where we've got flats of maybe 12 bedrooms at a time, that individuals aren't then passing that on to passing the virus on to others in the household as well.
Thank you very much, Becky. Did you have a follow-up question very quickly?
Yeah, sorry, just to Simon, if possible, just kind of on the calls you mentioned to parties at houses, I was just wondering if you could share kind of what is the most amount of people you've seen just at a single house, and kind of when and where this was, if possible.
That seems like a very anecdotal question, but I'll leave Simon to decide whether he can answer that one. Simon.
I don't actually have that information at my fingertips, but I mean, roughly, most people, what we're finding is their numbers that are sort of just over the required limit, which is why we haven't issued any tickets yet. The vast majority of cases where people are just over, so advice is being given. Some of the issues, of course, we do have at the weekends is having the resources available to attend all the phone calls that we get, but I can't give you a specific one of the most numbers that we've had. But we do gather that data as we go. Thank you.
Thank you very much. Thank you for attempting to answer that, Simon. I'm going to move on to Laura Coffey from BBC Radio Northampton. She's been patiently waiting, as always. Hello, Laura.
Hello. Hi. So I've got several questions as normal. So firstly, this is obviously quite a U-turn from what was being discussed last week around care homes and enabling more visitors. I wondered what's the evidence that you have for introducing the new measures around visitors to care homes, but also for asking spectators not to attend sports events. Lucy, you touched on this, and about the extenuating circumstances for visiting care homes. So is it just, you said end of life, is that just when the only kind of time people now should really be visiting people in care homes. I also wondered what further measures would you consider introducing, depending on where you are on that 3-tier system. And then a little bit on the transmissions in homes. So I know we've talked about this previously with the houses of multiple occupation, with the Green Court outbreak. Is that where the transmissions are? And also, how can you and all of us really prevent the transmissions in homes from happening? I'm guessing trying to encourage people to isolate in their own home away from their own family is just not happening at the moment.
Thank you, Laura, very much for that. Lucy, are you there? Although, is Katie Brown still on the call? Katie, are you there? She's a director of adult social care in the county. I don't know whether she is. And we seem to have lost Lucy as well. Have we lost everyone? Have I disappeared? No, I'm still here.
You're still here.
Yeah. Sorry, Laura. We may have to wait for a little bit to see what's happened with Lucy there. Apologies. Did you want to ask any other questions of anyone else that's here in the meantime?
I guess the only other one was to Jonathan Nunn. You mentioned, Jonathan, about the cases and the fact that our rates obviously aren't compared to England and compared to where we were previously in August, but that is surely down to the fact that the rates in other parts of the country have increased, that it's not necessarily because of changes in behaviours. It's because rates across the country, well, in other parts of the country, are much higher than we're seeing now in the county.
Yeah, Jonathan, if you would reflect on that.
Yeah, I mean, entirely right, Laura, and I think we've reflected on that before, haven't we? Really, I think at one of these previous events, I'd said something like, having promised myself some small celebration of some kind when we hit the averages. But of course, when we did, the national ones were coming up so much that it was by no means worth any sort of celebratory comment or remark. Really, it was, that celebration was, if you like, stolen from us because the rates were coming up so much. So you're absolutely right. Nevertheless, as a national benchmark, we were previously incredibly highly above it. And now we have come down to around that average, or indeed, bit below it. That there's no cause for complacency in that, certainly. But nevertheless, what it does show is that in Northampton we have done something to influence our figures as compared to the national average. Otherwise, we would still be, much higher than national average. It's as simple as that. It's not to say in any way we can. We can take the foot off the gas or relax or anything at all. And it is, as you say, in a context where national figures have gone up shockingly. We would never have wanted the national figures to be where they are. If anything, we would have wanted the national ones to continue going down and the Northampton ones to have come down to meet them. But yeah, so I take your point.
Thank you, Laura. Yes, Lucy's not on the call at the minute. So she's going to try and come back in. So can I come back to you, Laura?
Yeah, sure.
I don't. Well, we may have to abandon ship if all the questions are for her, but we'll do our best. Can I come to Neil Barber of ITV Anglia? Hi, Neil. I'll come back to Laura. Thank you.
Hi, Ian. This one's for Jonathan, if that's okay. Sure. There's a stark change in tone to this week's press conference. It's much more dejected, a lot more sombre, and there's a distinct taste of worry in the air. I mean, do you think there's any hope of turning the tide on this without new measures? And what would you say to anyone who's thinking about Sunday's going to be a nice day in Northamptonshire, maybe meeting in a house with 5 other people? Would you discourage that? Because clearly the rule of 6 isn't enough.
Jonathan.
Yeah. Thank you, Neil. Yeah, that's interesting. You pick up that vibe. I guess you're right. I talk about that personally. I'd agree with all those words you said. I feel thoroughly disappointed. I feel really, dejected about this whole thing, really. I really, really do. I've had enough of this virus, and I'm sure everybody else is the same. I want the world to get back to normal. And, I hate the threat that hangs over each of us, particularly the more vulnerable people, perhaps older or with health vulnerabilities, that they may catch something really horrible that could lead to their death. So I'm very fed up, and I'd buy into all of that. What should people do this weekend? I think continue to do what we might have said last week. We had a similar question about should people do such and such. The answer is I think they can, and they should make sure they're doing it within the guidelines. I wonder if we are also, this is a very personal opinion, I'm reflecting because I think your questions caused me to reflect. I think partly what we're saying is maybe there's a proviso of if you really feel you have to around everything now, isn't there? So, it's quite reasonable for me to safely say I could go and meet somebody, I could do this, I could do that. And I could do, but perhaps that fits under the phrase that I've heard Lucy use today. Just because you can doesn't mean you should. In other words, I could technically probably now go to some form of work thing, but actually if I can find a way of doing it from home, that's what I should do. I could technically go and meet up with 5 friends in one of our homes. But just because I can doesn't mean I should. And I suppose I am now considering that, as well as following the guidelines as I've done everything I possibly can to make sure that I do, I would be more reluctant than I was before even to do something, even if it was within those guidelines. It's not for me necessarily to tell them what they should or shouldn't, but I think the answer is if you are in any doubt, if it's something you think you can do without, if you can find this new electronic way of communicating face-to-face with friends and loved ones, as we all have done. My family, we do a WhatsApp call at 3 o'clock every Sunday. That's how we keep in close contact. And my mother has become an advocate of the technology in a way I never would have imagined. So I think my advice would be cautious. As Lucy says again, if you don't have to, just because you can, doesn't mean you should. Perhaps it's best not to. Thank you, Ian.
Thank you, Jonathan, and thank you for your question, Neil. I see, Lucy, you are back. The gremlins, you obviously didn't put any money in the meter or something like that, but you are back. So if I can come back now to Laura, and then Laura Coffey. Yes, please. Hi, Laura.
Hi. Sorry, so I'll repeat those questions.
Would you mind? I know, because I don't...
No, that's okay. So to begin with, I was saying it was quite a U-turn from what was discussed last week around care homes and enabling more visitors. I just wondered what's the evidence for introducing the measures around visitors to care homes, but also asking spectators not to attend sports events. I wanted to just get a little bit more explanation on what exactly is meant by extenuating circumstances for visitors to care homes. You mentioned there, Lucy, about the end of life. Is that really the only situation you would suggest that people visit loved ones in care homes? Also, you mentioned there about I wondered what further measures you would consider introducing in the county. Obviously, I know we're getting the list next week, so maybe it's more something for next week. And then I just wanted to touch on the transmissions in homes. So you've talked about that most of the transmissions in the county are mainly happening in the home. So how do you and then all of us really prevent this from happening? So obviously encouraging people to isolate in their home, and away from their own family is clearly just not happening. We heard a lot of this back in March, April about how you should isolate in a room in your home, but I guess that's just not happening. And back when we had the Green Court outbreak, you talked about houses in multiple occupation. Is this the issue where transmission is occurring at the moment?
Thank you, Laura. A thoroughly comprehensive list of questions, as always. We've come to expect nothing less. Lucy is back with us. Welcome back, Lucy. Sorry about that gremlin in the works. If you wouldn't mind addressing those questions, that would be great. Thanks, Lucy.
Of course, and profuse apologies. Obviously, clearly IT's given me up on a Friday afternoon. So, lots of questions. Laura, remind me at the end if I haven't responded to any of them. A U-turn, yes, I'll hold my hands up. That's unfortunately what it is, but I'm sure people will recognise that is in response to the starkly different position that we are in this week as compared to last week. As Jonathan says, we did get on top of this. Things were looking very good locally. We know that there has been some delay in IT reporting, but these are real cases. This is a real spike, and therefore we've got to take appropriate action to reduce the risk of any further onward transmission. So that's the reason for the U-turn. It will be up to providers individually to assess what constitutes extenuating circumstances, but each of those providers, as we know and we've seen for weeks now, are very conscientious, are taking a very risk-based approach, and will allow visiting where it is appropriate. So end of life, there are other circumstances, particularly around mental health and the management of mental health conditions, etc., where that is in the best interest. A visit would be in the best interests of particularly the patient or the resident in mind, but it is at a provider's individual discretion, and again based on their risk assessment of both harm and risk to individuals and the visitors. So I wouldn't give a kind of a definitive list under those circumstances. Spectators, the rationale for that, similarly, we know that these are events where lots of people meet and mingle. We know that our issue at the moment is community transmission, and we know that sports events are things that young people tend to either participate in or attend as spectators. And again, we also recognise that there's an age band here where it may be parents attending sports events where their children are playing. We recognise it's a challenge. Everybody wants to watch sports events. It's one of the things that feels a lot more normal at the moment. But we just have to be clear about the fact that crowds pose an increased risk, and therefore where we can, we are recommending that anything that constitutes a crowd is not sensible and therefore shouldn't be encouraged or to go ahead. Further measures, as I mentioned earlier, I would be going harder, but what I don't want to do is then contradict what will be potentially some new guidance about different levels of lockdown. As I said, we will then reflect as a system as to whether we feel the level that is sort of recommended that Northampton sits in is appropriate and feels that it's going to be adequate to stem what is quite a startling change and increase in the flow of cases locally. So again, probably a question to come back to, as you say, next week. I'll be able to give you a more definitive answer, but you know my concern here is that the government aren't going to potentially go hard enough in areas where there's still the opportunity to get on top. And I do genuinely believe that Northamptonshire is still in that space. Transmission in homes, yes, it is what seems to be driving our transmission. As I said, we've got an increase in the number of cases within each household. I don't pretend that isolation within a room in a house, particularly if you're a parent or a carer, is easy. It really isn't. But again, you can do things like wear a mask indoors. It isn't just for settings that, outdoors or where you're with people other than members of your household. Hand washing is one of the easiest things to do. As I said, the thing that kills the virus, again, is just bleach. So again, a really cheap, easily available product. Go mad. Spring clean your house in autumn. If you're a case, you need to make sure that your environment is as clean as possible. And again, if you can limit movement in areas where quite often families congregate in kitchens, in bathrooms, etc., then please do. I recognise it's a challenge, as I said, particularly if you're a carer or a parent. But you want to protect your loved ones, I'm sure, and there are measures and steps that you can take where you can do that. And as I said, we'll be producing some more guidance next week to help people understand what they can do. Houses of multiple occupancy were a feature of Green Core. They are a feature basically in all of our more deprived areas and our more densely populated areas. Landlords have been very receptive to additional support. At the moment, they are not featuring heavily in our reports that give details about the cases at a borough and district level. But again, we continue to work with landlords, and we've been providing, as Becky's alluded to as well, landlords where there are a number of students in accommodation as well with additional support so that they understand what can be done to reduce the risk to the people that live there.
Thank you very much, Lucy. Laura, I would give you, do you want another question? I've got two more people.
No, that's fine. I was just going to say thank you for that. That covers everything. Thank you.
Thank you very much. So I've got Phoebe from Northants Telegraph and then Kevin Nichols with two more questions, and then I think we'll close proceedings after those two questions if everyone's happy to do that. So Phoebe, hi.
So this is a follow-up to the questions I asked earlier, so quite a while now. But you mentioned about the importance of even people that are asymptomatic, like isolating. That's why people that have symptoms in a household should isolate, like in case other members then catch it. But how much of a challenge is it going to be to stop the spread of COVID if you do think there's a fair number of people that are going to be asymptomatic? Because surely then they don't know to book a test or to isolate. And then before you know it, the whole household has it. So what advice or how much of a challenge is that?
Thank you. That's a very good question. Lucy.
Yeah, as I mentioned earlier, this is one of the most challenging aspects about it. And I've mentioned, you know, it's a silent virus, it's a silent killer. So many people, particularly younger people, don't have symptoms. And we've even seen through the asymptomatic swabbing programme that's currently run through care homes that even some of our more vulnerable and elderly have got it mildly and therefore don't have symptoms. So it is a real challenge. And until we have, you know, routine asymptomatic screening, we won't be able to definitively identify everybody who is infected. What we can do, though, obviously, is, like we talked about today, take sensible steps to reduce the risk of transmission. If you were to imagine that everybody out there in the general population and in, you know, even in your household to a certain extent were infected, people would behave differently. I think the thing is, people are behaving as if everybody's not infected. You never know. Genuinely, you never know, and therefore you should be taking those simple steps around cleaning your hands, wearing face masks, creating space, and where possible, if you have any concern about being infected within your household, you should be isolating. But it is a challenge, and as I said, until we are screening everybody on a regular basis, which at the moment there is, you know, not the capacity to do, sadly, we will have to continue to operate and work on the basis that people are infected and give them the space that they need.
Thank you, Lucy. Very, very comprehensive answer as always. Kevin, are you there? Kevin Nichols.
I am, Ian. Yeah, sorry, this is dragging on a bit now, and I hate to add one more question. Especially
these questions are very valid, actually. And
I'm just concerned. Lucy's voice sounded like it was going just at the end there. So she's done sterling work today.
And
I'd just like to ask about the thing about the sporting events, asking people not to going. I must confess, I've got a vested interest in this as a Wellingborough Town fan. It does seem it might well affect certain non-league clubs more than others that rely on income from fans through the gate to actually keep going and survive. I just wonder if she's conscious of that, and there may be some sort of leeway to allow certain numbers in.
Thank you, Kevin. Lucy.
Hi, Kevin. No, I mean, it's with a sad and a heavy heart that I make any of these recommendations. This is not the position we wanted to be in. We were hoping last week that we were headed to, you know, some greater sense of normality, and I am very conscious, as I am with businesses and the restrictions that are currently imposed on them, that these restrictions, these recommendations quite often have a financial impact. So I'm very cognizant of that. It isn't a recommendation that I take lightly. None of the decisions that I make, I take lightly. But at the end of the day, if there is, you know, a way of trying to reduce the risk, we are quite happy to work with the FA, to work with each individual club to assess what we might be able to do to mitigate that risk. More than happy to obviously entertain and engage with any businesses to try and find a safe way to maintain what we can do. But in the interim, again, it's just taking that common sense approach. Cases have more than doubled. Just because you can doesn't mean you should. So people need to act conscientiously and sensibly.
Thank you very much, Lucy. And thank you for that question, Kevin. I think I could hear you furiously typing away her answer there in the back.
Yes.
Word for word. That was very impressive. I think we'll leave it there if that's okay, unless you have any questions, Kevin.
No, I'm fine. Thank you for that.
Perfect. Thank you very much. Can I close the meeting now and say thank you very much, everyone who's attended as always. Thank you for the questions. thank you for the answers, and thank you all for attending as always. I wish you all a very good weekend, and stay safe, and let's all follow the guidance. Good afternoon.
Thank you.